Welcome to Mentally Healthy. We're so glad you're here. We are very proud to welcome and introduce Innovative Products as the sponsor for today's video and content. IPP supports the ongoing mission of Mentally Healthy and our affiliations. As Innovative Products' tagline outlines, Mentally Healthy honors discovering the possibilities together.
Let's take a moment to relax and breathe. Today, we're going to learn and explore 5 key things to know concerning mood disorders. A mood disorder is a mental health condition that primarily affects your emotional state. They can cause persistent and intense sadness, elation, and/or anger. Mood disorders are treatable, usually with a combination of medication and psychotherapy, talk therapy. There's a lot to unpack in this topic, so join us as we explore 5 key things to know concerning mood disorders. If you're ready, let's get started. Number 1. What is a mood disorder? A mood disorder is a mental health condition that primarily affects your emotional state. It's a disorder in which you experience long periods of extreme happiness, extreme sadness, or both. Certain mood disorders involve other persistent emotions, such as anger and irritability. It's normal for your mood to change, depending on the situation. However, for a mood disorder diagnosis, symptoms must be present for several weeks or longer. Mood disorders can cause changes in your behavior and can affect your ability to perform routine activities, such as work or school. 2 of the most common mood disorders are depression and bipolar disorder. Number 2. What are all the mood disorders? Mood disorders include depression and its subtypes, bipolar disorder and its subtypes, premenstrual dysphoric disorder, disruptive mood dysregulation disorder, depression. Depression, major or clinical depression, is a common mental health condition. Depressive symptoms include feeling sad or hopeless. The condition can also cause difficulty with thinking, memory, eating, and sleeping. For a person to receive a diagnosis of clinical depression, symptoms must last for at least 2 weeks. There are several different types of depression, including postpartum depression, peripartum depression. This type of depression occurs during pregnancy or after the end of a pregnancy in women and people assigned female at birth, AFAB. Women and people AFAB experience hormonal, physical, emotional, financial, and social changes after having a baby. These changes can cause symptoms of postpartum depression. Persistent depressive disorder. This is a chronic form of depression that must last for at least 2 years. Symptoms may occasionally lessen in severity during this time. It's less severe than major depressive disorder, but it's ongoing. Seasonal affective disorder, SAD. This type of depression occurs during certain seasons of the year. It typically starts in the late autumn or early winter and lasts until spring or summer. Less commonly, SAD episodes may also begin during the late spring or summer. Symptoms of winter seasonal affective disorder may resemble those of major depression. They tend to disappear or lessen during spring and summer. Depression with psychosis. This is a type of severe depression combined with psychotic episodes, such as hallucinations, seeing or hearing things that others don't, or delusions, having fixed but false beliefs. People who experience depression with psychosis have an increased risk of thinking about suicide. Bipolar disorder. Bipolar disorder is a lifelong mood disorder and mental health condition that causes intense shifts in mood, energy levels, thinking patterns, and behavior. There are a few types of bipolar disorder, which involve experiencing significant fluctuations in mood referred to as hypomanic or manic and depressive episodes. There are 4 basic types of bipolar disorder, including bipolar I disorder. People with bipolar I disorder have experienced 1 or more episodes of mania. Most people with bipolar I will have episodes of both mania and depression, but an episode of depression isn't necessary for a diagnosis. Bipolar II disorder. This disorder causes cycles of depression similar to those of bipolar I. A person with this illness also experiences hypomania, which is a less severe form of mania. Hypomanic periods aren't as intense or disruptive as manic episodes. Someone with bipolar 2 disorder is usually able to handle daily responsibilities. Cyclothymia disorder. Cyclothymia. People with cyclothymic disorder have a chronically unstable mood state. They experience hypomania and mild depression for at least 2 years. Other specified and unspecified bipolar and related disorders. Symptoms of this type of bipolar disorder don't meet the criteria for one of the other types, but people still have significant, abnormal mood changes. Premenstrual dysphoric disorder, PMDD. This type of mood disorder occurs 7 to 10 days before menstruation and goes away within a few days of the start of the menstrual period. It's a more serious form of premenstrual syndrome, PMS. Researchers believe this condition is brought about by the hormonal changes related to the menstrual cycle. Symptoms may include anger, irritability, anxiety, depression, and insomnia. Disruptive mood dysregulation disorder, DMDD. DMDD affects children and adolescents. It involves frequent anger outbursts and irritability out of proportion to the situation. DMDD is more severe than intermittent explosive disorder, IED, and anger is present most of the time, occurring before the age of 10. Number 3. Symptoms of mood disorders. Each mood disorder has different symptoms and/or different patterns of symptoms. Mood disorders typically have symptoms that affect your mood, sleep, eating behaviors, energy level, and thinking abilities, such as racing thoughts or loss of concentration. In general, depressive symptoms include feeling sad most of the time or nearly every day, a lack of energy or feeling sluggish, feeling worthless or hopeless, loss of interest in activities that formerly brought enjoyment, thoughts about death or suicide, difficulty concentrating or focusing, sleeping too much or not enough, loss of appetite or overeating. In general, symptoms of hypomanic or manic episodes include feeling extremely energized or elated, rapid speech or movement, agitation, restlessness or irritability, risk-taking behavior, such as spending more money than usual or driving recklessly, racing thoughts, insomnia or trouble sleeping. Number 4. Causes of mood disorders. Researchers believe several factors contribute to the development of mood disorders, including biological factors. The brain areas responsible for controlling your feelings and emotions are the amygdala and orbitofrontal cortex. People with mood disorders have been shown to have an enlarged amygdala on brain imaging tests. Genetic factors. People who have a strong family history of a mood disorder are more likely to develop mood disorders, which shows that mood disorders are likely partly genetic or inherited. Environmental factors. Stressful life changes, such as the death of a loved one, chronic stress, traumatic events, and childhood abuse are major risk factors for the development of a mood disorder later on in life, especially depression. Depression has also been linked to chronic illnesses, such as diabetes, Parkinson's disease, and heart disease. Number 5. How are mood disorders diagnosed? If you or your child are experiencing symptoms of a mood disorder, a healthcare provider may perform a physical examination to rule out physiological causes for symptoms, such as thyroid disease, other illnesses, or a vitamin deficiency. Your provider will ask about your medical history, any medications you're taking, and whether you or any family members have been diagnosed with a mood disorder. They may refer you to a mental health professional. A mental health professional, such as a psychologist or psychiatrist, will conduct an interview or survey, asking questions about your symptoms, sleeping and eating habits, and other behaviors. They use criteria in the American Psychiatric Association's Diagnostic and Statistical Manual of Mental Disorders to make diagnoses of mood disorders. In general, a mood disorder is diagnosed when sadness, elation, anger, or other emotion is overly intense and persistent, accompanied by other mood disorder symptoms, such as sleep changes or activity level changes. Significantly impairs the person's capacity to function. This concludes our video on the 5 key things to know concerning mood disorders. If you or your child are experiencing symptoms of a mood disorder, talk to a healthcare provider. If you've been diagnosed with a mood disorder, you'll likely need to see your provider and/or mental health professional regularly to make sure your treatment plan is working. Discuss any concerns you have about changing or stopping medications with your provider or another health professional. Ask them whether you might need to try a different medication or have the dosage adjusted if the one you're taking isn't working or causes unpleasant side effects. These questions might also help. Who do mood disorder affect? How common are mood disorders? How are mood disorders diagnosed and treated? It's important to remember that mood disorders are mental health conditions. As with all mental health conditions, seeking help as soon as symptoms appear can help decrease the disruptions to your life. Mental health professionals can offer treatment plans that can help you manage your symptoms. Please share with us your experiences in this area. If you or someone you know are experiencing symptoms of mood disorders, please know there is help. Finding a therapist who truly specializes in the treatment of the disorder and understands how to treat it effectively is an important next step. Your friends here at Mentally Healthy support the American Psychological Association for finding a good therapist and ensuring you work with a qualified professional who has background and expertise that will benefit you and your specific needs. We are not affiliated with that organization and receive no special compensation for recommending them. We just recognize the importance of finding qualified professionals to help us when help is needed. Another great resource is also available for those that can take advantage of it. For all our viewers that reside in the United States, a hotline is available to act as an immediate response lifeline center for all suicide and crisis events. Just call or text the number 988, local rates may apply, to immediately be placed in touch with someone you can talk to. If you are a U.S. veteran or military service member, you may text the U.S. Veterans Crisis Line directly at 838-255. Both of these resources will also be placed in the description area of this video. Use these trusted resources as needed.
Well, that's all for today. Thanks so much for joining us at Mentally Healthy. If you've enjoyed our video, please like it and consider subscribing to our channel, as we have lots of great new content in store for you. Subscribing, liking, and clicking the notification bell keeps you connected to us and truly helps our channel grow. Here's a few other great videos from our channel you can visit right now. Until next time, stay mentally healthy.